You've always known that few places are friendlier to babies than Women's Hospital. Now there's a plaque to prove it. That story and more in this month's Code View. The World Health Organization and the United Nations Children's Fund Award recognizes birth facilities that meet its 10 steps to breastfeeding success. For Women's Hospital, the designation was just the next step in offering new moms the information, confidence, and skills they need to succeed.
And all the care goes to the mother's room, our pediatricians, hearing screens, baby pictures. So that is part of those 10 steps.
Women's Hospital staff worked over a 22-month period, earning the designation. Few places have improved the way it cares for broken hips more than Cone Health. A hip fracture pathway was created to improve patient care. The pathway is a specific course of care that includes surgeons, hospitalists, nurses, and physical therapists. The team spent 2 years coming up with results that turned out better than hoped for.
Yeah, it's actually worked out remarkably well. And it really has come down to the teamwork between all of the different departments of the people involved. And ultimately, if we're able to get this process smoothly synchronized, provide a better experience for the patient, their families, and ultimately, hopefully, maintain their function long term.
The hip fracture pathway was recognized by the National Association of Orthopedic Nurses and at a recent AHEC conference. Few patients ever describe the experience of having an MRI as a day at the beach, but it does get closer with MRIs at Moses Cone Hospital. 2 caring suites were added to the MRIs. They allow the patients to select the music, change the color of lights in the room, and even the images they see on the ceiling.
Come into the room just like, wow, this is really cool, this is really nice. Helps them kind of forget about the MRI exam a little bit and be able to kind of focus on something else that's more pleasant.
Another highlight of this system is something that you can't see. A silent suite package means it's much quieter than other MRIs. These systems should not only improve patient satisfaction, but more importantly, make patients more comfortable and less claustrophobic, leading to better scans. Magnets have a new use at Cone Health. They have long been a part of MRIs. Now they bring about changes to the minds of people with depression. This is a transcranial magnetic stimulation device, or TMS. It uses magnetic fields to stimulate areas in the brain associated with depression. TMS is used for people who haven't found relief using traditional antidepressants. Cone Health Behavioral Health Hospital is one of the first places in the state to put magnets to work battling depression. Cone Health is now obtaining blood from the Community Blood Bank of the Carolinas. CBCC, as it is called, is also running employee blood drives across Cone Health. Other than the different signs, you probably won't notice anything different.
I think there will see very few changes. We do a manual interview. We are not computerized at this point. The donation process otherwise
Cone
is
Health
exactly
gets 2
the
seats
same.
on the board of CBCC, ensuring a big say in the operations. The organization provides blood to 27 hospitals in 22 counties in North Carolina. Congratulations, Dennis Campbell and Wakia Ellis. They have been named to the 40 Leaders Under 40 by the Business Journal. The honors are based on their contributions, not just at Cone Health, but to their communities and our region as a whole. They were honored at a recent reception. That's it for this edition of Code View. I'm Doug Allred, and we'll see you next time.